Committee. And, we'll have official call to order, and we've got a couple motions here. The first is to approve our agenda for today, the 28th. And the motion is to approve the recipient rights agenda.
So move.
Support.
Any further discussion? Seeing none, all those in favor of approval of the agenda indicate by saying aye.
Aye.
Next is the minutes from back on September the 29th. That would be for our recipient rights committee meeting. We'll entertain a motion for approval of those minutes.
So move.
Support.
By Dannenberg, seconded by Dave Perrin. Is there any discussion on those minutes? They look good. All those in favor of approval indicate by saying aye.
Aye.
Those opposed, motion carries. This is our first opportunity for public comment. And so those in the audience or on Zoom that would like to make a public comment, please state your name, your address, and please limit your comments to 3 minutes, please. Looks like we're good to go there. So we'll move right into our new business. Our reports from this quarter, 9/21 to 2/22. And Brianna, you're gonna lead us through this.
I'm gonna lead you through it. We didn't have a December meeting. I was driving a child home from Arizona. She decided that college life in Phoenix, Arizona was not for her.
Oh.
Too far
So
from
now-
mom.
I don't know about that.
Well, maybe.
She seems to enjoy being at Grand
Well, they
Valley.
got knocked
so-
out of the basketball tournament anyway. So
I
they
know,
don't care.
I know, and she had to wait like
Yeah.
5 hours in line to get even into a game, so
Oh,
she was
yeah.
pretty disappointed. Anyway, so we have just a summary of the rights complaints that were opened and closed from September to February. Kind of busy, I mean, considering usually over some of the holidays and before the holidays, it slows down a bit, but not really this time, so. Opened 9 and closed 1 in September. That's really kind of when it started to pick up. October again was a big month, going into that one. So opened 7 complaints and I closed 15 in that month. None of them are over 90 days. Some are right at 90 days, but we have up until 90 days to complete a recipient rights a report. You'll see the asterisks next to if anything's over 30 days, because you have to send status reports at 30 days and 60 days. So that's just indicating that that was done. November, a little slower, opened 6 complaints and closed 5. December, slow, opened 2, closed 2. And then in January, we pick up again where we opened 5, closed 7. And then in February, opened 1, closed 5. So March has also been kind of a slow, kind of quiet month, so which has been kind of nice because it's been allowing me time to catch up on some of the busier ones. I know Lynn's been signing quite a bit of them lately. Yeah.
I'm just looking at the months here, right? No, it's not right. Go back up a little ways.
This way?
Yeah, the months right there. Do you go look back at the years? I mean, like what was January of 21? Was it about 235? I mean, does it always stay
for the-
pretty consistent
Yeah,
on these different months or?
yeah. So what you're looking at are the incident reports that come in. And during COVID, this has been pretty familiar, pretty
Okay.
steady. We usually get between 200 and 300 incident reports every month. So it's
find an incident
an incident is something unusual that happens. So
internally or
No,
is it,
it's
okay,
at either internally or at our contractual providers. So it could be, somebody had some bruising, somebody
Gotcha.
was self-injurious that isn't
Or you
typically
had to contact law
self-injurious.
enforcement or
Yep,
something.
we
Okay,
needed police assistance or had to go to the emergency room.
okay.
So the February is a smaller month, so too.
Yep.
You got 165, is that low?
No, that's
No.
pretty
Difficult for
pretty
that
typical
month?
for that month, yeah.
Thank you.
And those are completely separate than complaints.
This incident reports are separate than complaints,
Okay.
yes. So, like you all reviewed the annual report in December virtually, right? Like you got it via email. And so we were up in complaints, for the year, last fiscal year. And I think we're probably on track to do the same again for this year. Based on what I see already in
You've
this.
generally seen a spike or increase during the COVID periods over these
You
last 2
know,
years.
Kind of, toward the end of COVID, I think people were finally like, okay, we want to get out, and, some providers were, nope, we're not gonna do that yet, and then there were some complaints, like, I have the right to freedom of movement, or we had some staff, with the hiring crisis. We're not really seeing great staff. And so, I would say on this report, a third of the complaints are probably for one client. Because the staff and the supervisors just didn't understand how a behavior plan was written. And so, every incident report that didn't come in as a complaint, we opened up as a complaint because they weren't providing, services how it was prescribed in a behavior plan, which could have put that person at risk of harm.
So what did we require of that contracted agency? How did we require them to handle their staff in terms of better training or education?
Yep. So we didn't require them to do anything. The state required them to take disciplinary action with each staff.
Okay.
Many of them left the agency, so they are no longer working for that agency. Some were terminated. Some received written reprimands. All of them that are still there received multiple retrainings.
Yeah, okay.
So, we feel like they took proper action.
The people that, okay. Employment termination, employee left, what's their pay?
I don't even know what people get paid. Mm-mm.
Are you asking what a direct care worker is typically paid right now?
Something like that, yeah.
So we've increased our rates for most of our providers, and there's a direct care worker pass through.
Okay,
They're somewhere near 15, 16. Which is a lot better than 12.
Lynn, I'm not saying that, but, they get terminated. Oh, will I ever find another job? Oh, maybe in a half hour I'll have one.
Right, or
So,
less, right. Yeah.
this is, I'm not dissing anything, but this is something for the very vulnerable that we can't, we have no recourse, we can fire people, but we have a hard enough time trying to get someone to replace that.
Mhm.
So it puts a burden on the other people that are working there.
It's
Okay.
not a good situation right
No.
now.
So are you suggesting that the income level is low?
A little bit. That's all I'm
Okay,
saying.
good.
I'm just
I
thinking
would agree
it's
with you.
low.
I was just wondering
Thinking
where
it's
you,
low.
I wasn't sure where you were going there.
Well, it's just that you could get that at McDonald's.
Yeah, exactly.
Maybe even a little bit better,
Right, and you're
and you have maybe less responsibilities.
absolutely,
Mhm.
absolutely.
And I think the theme that I hear what you're saying, and I totally agree. But I think the theme that I hear from a lot of our staff is they would rather have that burden and provide really great care for the people that we serve than to have those few bad apples and always worry about what's happening when those people are working.
Mhm.
And so, we do genuinely have a lot of people that care for the individuals that we serve, and they want
Too bad.
nothing but the best.
Just too
Yeah.
bad we can't pay them. And that is state control, Lynn,
Well, it's
up to our extent, right?
controlled in the we have to afford it within our budget, which is captated. But we, later on in our agenda for our board meeting, I can tell you some of the stuff that we've been doing to try to help stabilize our provider network.
Okay, okay. Thank you.
So moving on to training. Are there any new training items there on item number B, regarding the recipient rights?
With policy. Nothing new. The only one that changed was policy. Oh, I think it was one. What was this?
Confidentiality and disclosure?
Yep, and there was just one section that changed. It was all the terminology related to Michigan protection and Michigan or something. So
I think it's a truck.
it sounds like it does. So that, I just changed that section. Why I can't find it.
Attachment F?
So yeah, number G or letter G, that's where it talks about in policy 1.11. Talks about what they have the ability to access. And so I just changed their name from Michigan Protection and Advocacy to Disability Rights Michigan. But other than that, none of the other policies have needed changes. Because I have the new fiscal year policy checklist that I use, so.
Okay. Well, C, our budget.
Okay,
Let's take a peek at that.
Keith sent me the budget for this fiscal year. Not sure I understand any of it, but.
Well, you got them right in your
I
zip
have
file.
them,
Yeah,
so
the good
that's-
news is.
So that's good. I know, oh, shoot.
Oh, I remember your day for that one.
Well, it's kind of funny because I wouldn't know. Because I'm not even sure, like somebody will say, how much do you make an hour? And I'm like, I don't know. Do you not look at your check? I guess not. I don't know. So honestly, I don't really see anything too different from any other budgets. I mean, as the recipient rights, as a rights officer, we have to have so much training a year. So my training budget's probably a little different than some other departments because our contract requires that I get 36 continuing education hours that are approved by the Michigan Department of Health and Human Services Office of Recipient Rights every 3 years. So, but otherwise, I would say, with the motion, I have enough money, sufficient funding. I don't have any pressures which would interfere with impartial, even-handed thorough performance of the duties that I am required to perform in the rights office. So.
Feel comfortable in what you have. to work
Yeah, I
with.
think so. I don't know, I don't get told no, so. She hasn't come and said, stop doing this. I don't do anything, I don't think. I make a lot of copies, I send a lot of postage.
Can you tell me what's the increase in your budget this year?
What the increase in my budget is? I can't.
1 second. The main increases come from, the budget lines changed as far as, the salary went up because of certain accounting. Benefits changed slightly. From one other pension liability, anything else, and health insurance went up slightly because of it was projected, it almost never happens the last 3 years.
You get the loyalty payment.
That's not yet, so that's,
That'll be an April hit.
is, I have that coming, the budget that's coming up.
And the other 2%. Huh?
Did that answer the question, Al? Do you need more information about the, okay.
Yeah.
Only a little bit about the loyalty payment. I kind of understand a little bit, but be more specific.
The loyalty payment is being given to each one of the county employees that worked during a period of time in the past 2 years through the COVID. And it's, and if you're a part-time, I mean, it can be busted down into 2,000 or to 1,000, depending on how many, whether you're part-time or full-time. It's an additional 2% than what the staff got starting January 1st of 2022. So that virtually they got 2% and they got another 2% that will hit in April.
Okay, now that's not a one-time loyalty payment. That's ongoing.
Well,
increase.
the 2,000 and the 1,000 is a one-time. However, the other 2%, that will be perpetuity, that will be added on to their base salary. And, but that was not necessary, that was done for some retention also. It's just, you know, it's something like what Al was stating. We've got 65, 70 positions open for the county, and it's really competitive market out there. And so if we don't pay a decent competitive wage, well, then Kent County will start taking our deputies for road patrol or taking our folks. So that was one thing that we felt that we wanted to do for our county employees, is to thank them for their past 2 years and also to keep them with us.
This was not for elected officials. No elected officials got this rate.
That's correct.
$6,003 difference.
There is a suggested motion for this, and is to accept the community mental health recipient rights budget as has been presented and as we've kind of talked about, and forward it to the Board of Commissioners for approval for us.
Did you make that motion?
No,
Okay,
it's just
I'll-
a suggested motion.
I
I'm reaching
will
out
make
to
that-
you.
I will make that motion. Thank you, Chairman.
Support. Is there any further discussion? Seeing none, all those in favor indicate by saying aye. Aye. Those opposed? That motion carries. D, annual training.
All right. Here's your annual training that we're required to provide. Just an overview of what this committee is supposed to consist of. So having at least 6 members, a third primary consumer family members, and of that third, half shall be primary consumers. And Patricia does all the figuring and all that from time to time, and most of the time, I think we're in compliance with that. Right? We try. Protect the Office of Recipient Rights. So this is the committee that I would come to if I was needing support to protect me and, you know, make sure that I'm able to make impartial and even-handed decisions in the Office of Recipient Rights. Assure that I'm properly funded, that the office is properly funded to execute the duties, which we just did by reviewing the budget. And we're required to do so annually. And then serving as an advisory capacity to Lynn and myself. And then, of course, whenever we have recipient rights appeals that come in, you all serve as the Recipient Rights Appeals Committee, which we did not have, I don't even think this last fiscal year, but we did have some in the last fiscal year. So we do get them. And I think it's a pretty slick process that we have. So what are rights? A right is something that is defined by the law that a person is entitled to have, to do, or receive from others. So, you know, we want everybody receiving services treated with dignity and respect. I went on site visits last week, Thursday, and I was teasing Leah. Some of you were here, some of you weren't. But every time I go on a site visit, I think I end up getting sick. So we went Thursday. I don't think it has anything to do with it. It's just the weather. And my allergies and asthma, but you know, it's just really nice to go out to different locations and see staff again and see our recipients in action. And I mean, we got to see pictures of some of our most challenging individuals baking cupcakes last week and doing things that we would have never thought that that individual would have done. And watching the staff interact with many of them and how they just, you know, love their sense of humor. And, you know, it was just really very cool. It's been a while since we've been able to have that client contact. And so it was just awesome. And just, you know, really seeing the dignity and respect that the staff, at least at those sites that we visited, unannounced, we did not tell them we were coming. Just the respect that they gave to all of the Ottawa recipients was pretty awesome. We want to make sure everybody's protecting the confidentiality, of course. We don't want people abused and neglected, so keeping people safe, having services in sanitary treatment environments, making sure individuals are getting the services as prescribed in their individual plans of service, person-centered planning. There are roughly between 80 and 90 code protected rights in the state of, in the Michigan Mental Health Code. So, I mean, that's just a handful of probably the most common ones, the most frequent rights investigations that I would do. So, you know, there are quite a few rights that are covered there. I have the authority to investigate anybody who works for Ottawa County Community Mental Health and anyone under contract with Ottawa County Community Mental Health. So sometimes I get phone calls about a family member who is not like a paid community living support staff or anything. So I don't have jurisdiction over a mom, a dad. Most of the times I don't have jurisdiction over a parent or a guardian, right? So sometimes if it's a guardian that we have under contract, then I would have a jurisdiction to investigate. But sometimes we have to make those referrals to adult protective services or child protective services respectively. I have 90 days to complete an investigation after a complaint is received, with status reports coming to the recipient and the complainant and the parent if the recipient's a minor, a guardian if the recipient is an adult and has a guardian, every 30 to 60 days. I can reopen or reinvestigate if there is new evidence that was not present when I did the investigation. So for example, I finished a recipient rights complaint recently related to sexual abuse. I substantiated the allegation even without the police report. So, and I did say, if the police report comes back with additional evidence, I will reopen that investigation and include that information. So the outcome may change based on if the police ever go out there and do the report. I have a feeling that this police department is not really taking it too seriously, and they hadn't even talked to the person that was supposedly, you know, there was an attempted sexual abuse on. So I felt, based on the evidence that I had, that it did happen. So I substantiated it on my own, but I could open it if there's, like I said, new evidence. If I substantiate abuse, neglect, restraint, seclusion, even a failure to report, because that is a neglect allegation, the Michigan Mental Health Code requires firm and fair disciplinary action. So sometimes our providers like to send back that they gave a verbal counseling based on one of those allegations, and we have to send that back and say, sorry, that's not good enough. It at least has to be a written reprimand. But typically our providers take more action than what we might even think is necessary, but they do really well with that. Anything else like a dignity and respect, a breach of confidentiality, etc., just requires remedial action, and that could be a verbal reprimand or verbal counseling. Once the report of investigative findings is done, I have 10 days to submit a summary report to the recipient, to the person who filed the complaint, and or, parent of a minor, guardian of an individual. Sometimes I send that summary report because I still haven't received a written plan of correction yet from the provider. So I send the summary report with the appeal rights. And then say I don't get that plan of correction for a month or two, I then send another summary report. So I actually send an update. And I again attach appeal rights because then that person has the right to appeal my report based on the corrective action that they find it suitable, right? Then you have you guys as the recipient rights appeals committee. Only the recipient, parent of a minor, guardian, or the person who filed the complaint, the complainant, may file a written appeal for the committee to review the summary report. At least one of the following have to apply, that the findings were not consistent with the rules, the laws, the policies and guidelines. Or 2, the action taken, if there was some proposed, does not provide an adequate remedy. Or 3, I didn't start the investigation in a timely fashion. We have historically sometimes just reviewed an appeal just because it's good practice. And, it just validates people just to be heard and, seen, have it seen by another set of eyes. We have to initiate a response like, hey, we got your appeal within 5 days, and we have to finish the appeal within 30 days with a documented decision 10 days after that, which is pretty easy to do. So that's really all I have for today.
That's our training.
That's your training,
That was good.
wasn't it though? If you want something specific for next year, just let me know.
Thank you,
You're welcome.
Diana. The old business? None?
This isn't really old business, but I'm just wondering, with your quarterly report, can we get that with the packet? Instead of just
I
being
can, yeah.
projected?
Sure.
Just, it's, you look at it and it's like, okay, what is it all?
Yeah.
I know I'm a
like
little
to-
bit on the older side of life, so
You like to digest it? a
I like
bit?
to read it a little.
Yeah,
So thank you, I appreciate
Yeah,
that.
no problem.
Public comment. This is the second opportunity for public comment. Anybody online? No?
Bonnie, I just. look at
We
it.
are adjourned for recipient rights.
That's probably really boring.
Thank
Yes,
you,
I will attach it.
Brianna.
Thank you.
And we'll go right into our Board of Directors meeting. Officially call that to order. Is there someone that would like to do an invocation?
I will do it. for
You
you.
do?
Bet.
Thank you, Mr. Commissioner.
I'm here, please. Would you pray with me? Dear Lord, we come to you on this cold March day. Dear Lord, we also see the power in your nature as the trees and the birds are starting to come around for spring. But dear Lord, we are here for other business and serious business. It's the decisions that we make, hope and guide other people through difficult times. Dear Lord, thank you for all that you do for us. In your name, amen.
Amen. Thank you. Please note our mission and vision statements. Looking at our consent items that we've suggested motion for our agenda for approval for today, the 28th. As well as, we'll do a combo here, as well as the minutes from February the 28th.
So moved.
Support.
Is there any discussion? Okay, seeing none, all those in favor of approval of the consent items indicate by saying aye.
Aye.
Those opposed, that motion carries. Public comment? Did someone jump on in the last 60 seconds? No one for public comment? Okay, well, there'll be another opportunity at the end of our meeting. So we'll move on to presentations. None. Old business? None. New business? Our service contracts attachment. A. Hi.
I have one.
Wow.
So this is from those good ones. We have White Crane Home. It's a new personal care and community living support provider. They're located in Lansing. They will be providing services to one individual. And they will be on our standard boilerplate contract.
Okay, this is new,
The new
brand
provider.
new. Bob, you look like you have a question.
The individual is an Ottawa County resident.
Mhm.
Are they being, why are they being placed in a Lansing home?
That one, consumer choice.
Okay. Okay.
Any further questions about our one contract? Okay, we'll entertain a motion for approval of that service contract.
So moved.
Support.
Any further discussion? Seeing none, all those in favor of approval of the service contract for March 2022, indicate by saying aye.
Aye.
Those opposed, that motion carries. Next is our financial report, attachment B. B?
Just decided to share new financial statements.
That's attachment C, that's the budget adjustment.
Oh, this is budget. Okay, so we can pass those through.
Was that a premature pass-through?
It's premature pass through, so
Alright.
now we're even.
Mistake for mistake.
We don't need these or?
Well, we will. So just hold on.
That's the next item on the agenda. So we're looking at the financial statements ending February 28th. So we did receive the October, November final payments from the LRA. So you'll see the most notable difference from last month is that we have autism revenue and SUD revenue coming in, which is good. They still have not done December, January, February yet. Went into March.
Does that mean they haven't received money from the state?
They have received the money from the state.
So what's their problem?
They are having trouble figuring out how to disperse the money.
Give me
Or
a
slash
break.
time to do
Give
it.
me a frickin' break. Are you serious?
Their main complaint is that the CCVHC demonstration that the state picked up for the two CMHs that they're having trouble calculating.
Give me the acronym, the CC.
The Certified Community Behavioral Health Clinic.
Yeah.
So all five of us are in it now. Us, Allegan, and Never 180 are in the federally funded one. The states picked up it as a demonstration waiver for Health West and West Michigan. And so that's the main reason that they've said they're delayed in setting out the final payments. They're sending out preliminary payments, which is why you see Medicaid higher, the other ones lower and not the right amounts, because they don't tell us where the money is supposed to be going.
And why is it creating a delay? Do you know? Do they tell us?
That just, they're having trouble. So I know another
They can't
reason
count
to
or they
is
can't
the,
Divide or add
No,
or
it's-
subtract or?
so the LRE is growing exponentially as we draw towards the conclusion of the Beacon contract. And so previously Beacon had helped tremendously with that allocation of the funds. And so now that vacancy, that void of people picking it up.
Make the state feel comfortable that they don't need Beacon anymore when they can't.
Yeah. And so I know they're hiring
Right,
extra
right.
people for
Beat the
finance.
dead
They've hired a lot of
horse.
people, So the main two reasons I've heard why we haven't got a final payment for the other 2 months, but
Yeah, okay.
so if we look at mental health, we do have a slight surplus, mostly because contractual is always slow to pick up. It's picking up. 10-1 was probably our hardest year beginning that we've had. There's so many changes and several providers have had issues with that. We're working with each one individually, and we've pretty much overridden the 60-day limitation. So if people just bill it all, we're paying them, I mean, bill correctly, of course. So that's why there's a little bit of lag. There's always a lag at the beginning of the year, and it's always been loaded with higher expenses towards the end of the year because everyone's trying to get their year-end expenses in. So millage, we've seen almost all of our property taxes collected, which is good for this time of year. And we're still, so we're front loaded on money in that, and we're gonna continue to dispense those funds as the year goes on. I know that we're talking about, Lynn has a thing to talk about with the millage coming up in her report. And SUD is only in the deficit because of, again, those year-end or the finalized funds for those 3 months. And so because of that, we are closer. So there's only a $2 million difference between what's budgeted and what's actual. I don't project any differences because of the just the lag in those payments. So the first 2 months were about $600,000 or $700,000 a piece. So we look at 3 months, we should be well over $2 million, or close to $2 million.
I'm gonna beat the dead horse one more time. So do we need to be concerned about this looking down the road? I mean, we based a budget on what we've understood.
Yeah.
That they're gonna commit dollars to Otto County. So they're 3 months behind already.
They are distributing funds. So the money's there and they're distributing it. So I'm not concerned that we're gonna get the money. And we have enough cash reserves. Our other partners are actually
I
making
don't care. We
more.
got cash reserves. Those are our reserves. I don't have to
Oh.
use them because they short change us now later on
Oh, no.
because they screw something up.
No, I agree. And so the other partners are more cash poor, like Health West, and so they're complaining very heavily to the LRA. So the LRA is getting lots of complaints from all of us why they don't expedite this process. So I don't know where it goes after that, but
Well, they did come through the first 2 months, and we've been told that they are still working on those details. Part of it, it doesn't stop at the LRE, it's also conversations with the department about some of those funds that have to do with CCBHC. But at this point, I feel confident that we will get the dollars that we budgeted for from
Okay.
the LRE.
Okay. Any further discussion or thoughts on this? We need a motion for approval of the financial report and attachment B.
So
So move, supported.
Motion by Bob, supported by Al. Any further discussion? Seeing none, all those in favor of approval of the financial report indicate by saying aye.
Aye.
Those opposed, that motion carries. Budget amendment number 3, attachment C.
so there are several things going on with the budget adjustments. The most notable one is the 2% and the $2,000 incentive that's coming across. The millage wasn't really affected by that because most of the stuff was in the CCBHC budgeted already in contractual. We're just moving that into salaries and expenses, or there was surplus in there that we're using already in the budget. So I think the only difference between is $70,000. Mental health, we are increasing the revenue, so that's where the extra sheet came in. The original one showed an $816,000 deficit, which isn't the case. So we're going by, this is also aligning us closer to what the region's projections are for the income coming in. So we're increasing that and using and moving some other stuff from contractual to change to correct salaries and fringes for that. And there's also carryover from the SUD and the millage for the COVID grants that we're allowed to carry over that money. So that's where the extra swap income and stuff is coming from with those.
So the overall budget adjustment will be about all combined right here.
Yeah, so $1 million in mental health, $557,000 in millage, and $774,000 in SUD.
Any questions on those adjustments, in those categories? All good? We'll entertain a motion for approval of that budget adjustment.
So moved.
Or
Discussion, seeing none. All those in favor of approval of the budget adjustment, attachment C, indicate by saying aye.
Aye.
Those opposed? Motion carries. And our bucket report.
So just for information purposes, but this is the regions again for January's bucket report. We see that most of our members have reduced expenses slightly in mental health. But in SUD, Health West and West Michigan increased their budgeted expenditures for SUD funds. Still projecting a surplus for the end of the year at $13 million for the region. And then, of course, the breakdown of what their projected ISF is towards the end of the year.
There are some differences between the counties and different things, aren't there?
Yeah.
Pretty shoots right out at. Questions regarding the bucket report? I don't think we need a motion for this. It's just for information only.
this again isn't totally related to the bucket report, but Keith, as we look at this design of the LRE versus, I mean, it's probably never going back to the way it used to be, but is there a big picture look at the budget, like what, from the state's perspective of how much was spent on administrative costs with
Sure.
somewhat moving
So
into
the
the
state's really struggled with that, and they're currently in the middle of rolling out the standardized cost allocation methodology. It was supposed to enact 10/1 of this year. For a lot of people, we got an extension because of our GL just doesn't align with the way they want us to track those kind of costs. So I think everyone thinks the same thing is, you know, we need a more standardized way to see what everybody's doing. So this is I think a good step towards that. Once, if they can actually get, the whole problem is comparing apples to apples. So if you ask people to do something and then everyone gives you different data, well, this is what our admin and this is what our admin is, but it's all composed of different things. So this is, I think, a good first step towards that, and it'll probably be a few years before they finally get it. It'd be just in time to change again, and then we'll start. over.
Thank you.
Yeah.
Kind of hard to believe the state didn't do that like 50 years ago.
Yeah, I think they're making a lot of progress on trying to understand costs and the variations amongst the different PHPs and CMHs. So it's a very arduous task, though, to get us all speaking the same language.
Right, there's just standardization isn't there for so
Mhm.
many.
Mhm.
May I ask a hypothetical question? Why do we need a middleman? Why do we need the LRE at all? You got 40 some odd CMHs across the state covering 60 some odd counties. All the Medicaid dollars roll through the state. Can't the state allocate the dollars directly to the CMHs?
Well,
Sure.
right now, yeah.
Well,
No, it's not.
no.
In some, no, it's not, but.
No, I mean, all because the states, I mean, I could understand maybe why the state used to do it when they used to have the usage tax, which was a money laundering operation for them to throw back into the general fund dollars for matching in the next year's Medicaid allocation. But I mean, why Why does the state send it to the LRE and then the LRE doles it out to the CMHs? Why can't the state just dole it out to the CMHs directly?
So right now Medicaid rules require there to be a managed care organization. And that's not us.
Okay. Yeah, but that goes back to the
That
90s.
all started, the LRE started back with Snyder a little bit, or even before him. Didn't it, Lynn? Hobbleman?
7 years.
So the LRE has been in existence for 7,
Yeah.
8, going on 8
14,
years.
13, 14.
But the regional, the regions have been in existence for much longer than
Right.
that.
Yeah.
Yeah.
We were just in a different region prior to being,
Because the managed care thing goes back to the 90s when they
Mhm.
set that up. You did a managed care, you were an authority.
With the LRE, another layer was added.
Yes.
Right.
Yeah.
well,
So,
not,
sort of.
not really.
Place.
So the regions, there were 19 and now there's 10. But the region we were in previously was just us and
Muskegon.
Muskegon, which is
So
Southwest
who
now.
was the entity in that, for that region?
Muskegon.
Oh, so
Yeah.
it was,
They were the
okay,
PIHP. Yeah.
okay.
So the money went to them and then they doled it out to Ottawa
Right,
County. But we had a good work. At least my memory is that was always a pretty good working relationship.
Yes. Seems like we did.
Well, and I would imagine administrative expenses
I
have
went back and forth.
compounded
They were
because
short
they were
Medicaid and
managing
extra
that
Medicaid,
money
and vice versa. which
They were
made
saying-
sense.
They were,
Yeah.
it was Muskegon State,
with two instead of 5.
and now you have a whole entirely different entity, which is completely, you know.
Yeah.
Interesting.
Well, and there are definitely people in this world that would argue they would rather have a direct contract with the department. I don't really see that happening anytime in the near future.
So I said it's hypothetical.
Mhm.
Seriously hypothetical.
Mhm.
But you just, you kind of wonder, why did you ever set it up that way?
Well, since you're starting to do a little bit of talking, we move on to your director's report. If you would add maybe 2 things, if you're not going to cover the directors in your director's report already.
Mhm.
One would be in just that language that lady was referring to in our board meeting,
Uh-huh.
which, that she was concerned about. That was just kind of
Yeah.
interesting that I would like to even know for myself, because I don't know all the particulars on that.
Okay.
It can be just general. And the other thing, if you could just maybe while we're talking about the LRE, maybe allude a little bit to how the restructuring of the LRE and board members
Mhm.
may look down the road.
Sure.
And then, of course, you have the whole stabilization plan that will require a motion at some point here.
Yeah.
So it's yours.
Okay. So I'll start out with some news from the state and then I'll move to the provider stabilization plan and the motion. But there's been quite a bit going on. This has been a busy month from the state perspective. About 2 weeks ago, 3 weeks, we got sort of a mysterious invite to a meeting, all CMH directors and PIHP directors to meet with MDHHS to talk about our restructuring of the department, specifically the department that we've been under, which is BHDDA, Behavioral Health and Developmental Disabilities Administration. So the day before the meeting, we were asked to be a part of this meeting, and they announced a pretty significant restructuring of the department. It is now being called I have to find it, excuse me. So the initials are BPHASA, that stands for Behavioral and Physical Health and Aging Services. HASA, that Department Health and Aging Services was stood up several months ago, and they moved BHDDA into that department. Farah Hanley has been named the Deputy Director for Health, so she's over BP HASA. Farah's familiar to us. She's worked in the budget and finances for budget office and finances for many years. Part of that restructuring, and I can send you the PowerPoint presentation that we were given. We had that meeting and we haven't really had any follow-up from there. We did have an internal meeting with the board association, but we're still all sort of waiting to see how the details unfold with these changes. Part of the changes include creating a Bureau of Children's Coordinated Health Policy and Supports. So taking all of the children's services under the MDHHS umbrella and putting them into one idea, or I'm sorry, one area. The idea behind that is to improve coordination of services and leverage expertise. Again, the remaining part of BHDDA, which was our department, will be now under the same organization, which is that BP HASA. They are moving substance use and gambling disorder prevention, which was housed under our substance use disorder services, to the Bureau of Health and Wellness under the Public Health Administration. So I'm not entirely sure how that's going to unfold. And really what they said about these changes was that they feel like it puts behavioral health right in the same department as physical health, and will be able to better improve integrated healthcare and communication and expertise. Anybody have questions about that?
A lot of suspicions.
Well, you know, I'm gonna be optimistic about it, and they did a good presentation. The devil's in the detail, right? And we don't have the detail.
Is
So-
it a preemptive move to try to thwart Shirky's efforts, or is it a preemptive move to set the stage for Shirky's efforts?
Well, we were told that.
I don't expect
yeah.
an answer. I don't-
Well, that question was asked in our call with the department, and Elizabeth Hertel was actually on the call. Elizabeth is the director of MDHHS, and she said that it is not moving us towards any legislation that's currently pending. I mean, it's not an answer to that legislation, is what she said. Again, lots and lots of questions are still out there, and the detail I can't provide you with right now because I don't know it. I can send out the PowerPoint presentation that we were given, just to try and better explain it. And my hope is that what they're telling us is true, that it's going to really have us closer connected to healthcare services. They definitely seem like they had a well thought out plan, and you know, we're just wait to hear what their rest of their plan is as far as how things will unfold. I guess that's all I can tell you right now. So that was pretty big news. The other thing at the state obviously is the Shirky bills were getting quite a bit of press, at least in our world, because they were set to be on the Senate agenda, and then they got pulled. So they have not been put back on the agenda. Senator Shirky continues to publish some information about what his proposal will do or what it won't do. Some of the things he's talking about with his plan these aren't new. You know, coordinated health, and making sure that a person's behavioral health and medical and physical health are addressed. I'd argue that we currently do that in efforts like CCBHC. Some of the health homes that are going on within the state are already really doing those things and will continue to do them in the future. I don't know if anybody has any specific questions about Senator Shirkey's bills. There have been some modifications. I think I sent you the last modifications. If not, I can get those out to you. Mary Whiteford's bill, there have not been a whole lot of movement on her bills. They did have a public hearing last week. Alan Bolter from the Board Association was there and gave testimony. Some of the things that Mary Whiteford's bills do that Shirkey's bills don't. It maintains the CMH system. It also maintains local control and governance. There are some issues with her bill as well, as far as I'm concerned. And we've been, the Board Association has been speaking with Mary Whiteford and explaining some of our concerns. I don't think we're hearing there's not gonna be a lot of movement probably on those bills until closer to the end of the summer, is what we're hearing.
We met with our legislators and Senator Victory on Friday, Al and I, and some other staff. And Shirkey's is about 3 votes shy.
Yeah.
There was some discussion about the two of them coming together, the two bills, in some sort of a blend. And that seemed to have at least one of the representatives interested enough to listen to what that blend would look like. But in its purest sense, he's about 3 shy, which is not very much,
No.
but yet it's still there. So I don't know if you have something to
Yeah,
add.
I had Health and Human Services this morning. And we concentrated, Megan did, mostly from MAC, concentrated mostly on Mary Whiteford's bill.
Mhm.
Because she says there's no support for Sharpley's bill. And she realizes that they all do, that he will get the votes, but he won't get them until lame duck. And she said, she feels that both of the bills will happen during a lame duck. Now, what is there? So she said that Mary Whiteford's bill, and Mary has been much more open to all of them, saying, okay, what do you need? One thing came up today that Mary's doesn't have in there is anything with SUD or substance abuse. And Megan didn't understand it all either. And if you just take that away, there's money coming in from the PA too. Who's gonna have that? And if there's no mental health board or anything, then you're sitting there in there. Oh, okay. So she's gonna ask Mary what she plans to do with the SUD. Okay, that is one thing that Mac wants to get straightened with her. I said, I'm meeting mental health this afternoon. I said, I would, excuse me, ask you if you got one or a couple questions that you would like her to ask Mary Whiteford, where this happens, okay?
Sure.
Because she said that eventually somebody wants to make a change, you know? She said, so I would rather be where the side of change where it would work out the best for more of them, not perfect, but and no one's saying that there couldn't be room for improvement. So she says, let's, she thinks Matt will work on this too and stay on Mary Whiteford's bill. And then maybe you would get enough people to get rid of Sharpie's bill. So, but anyway.
Is Victory still supporting Shirkey's
You know,
bill?
it's very, very hard to get a read on whether he is supporting it or he isn't supporting it. He certainly listens to the dialogue that we have one-on-one or is in a group setting like we did on Friday. But I can't get a real true read unless you can, but
No,
It's
Well,
real cautious.
Uh,
on what it
Matt?
says.
We, at the conference last week, Phil said to us from the workers of MAC,
Mhm.
okay? They said that Roger will vote with the leadership team.
Okay, well, that would be a yes then.
Yeah.
Was he one of the three or you don't
No.
know?
No,
No.
No, he's not being included in the three whose votes. You know,
That's right.
he doesn't feel he has,
No.
but of course, no vote has taken place.
Roger has a bill, a couple other ones have bills in there, and they can't get it out of their committee
Mhm.
without leadership taking it out of their committee and putting it in the committee that will get it on the floor. So, yeah, we're starting to see that plan lay
little
out.
back scratch.
Yes, true
Yeah.
politics at their finest.
Well, I think when I spoke with Roger, he admits that that's what politics are, right? I mean,
Yeah.
I think he was being honest and fair when I spoke with him. He is concerned about the CMHs and he wants the CMHs to continue. And he said he would do what he could to protect the CMH system. If you take away the PHP system, like Shirky's bill suggests, if you take away the PHP system right now, that would impact the CMHs. There's no protection there. So I agree with you that our system is willing to change. We've really been constantly making changes. CCBHC is a really good example of a change that we've all embraced to try to get us closer to integrated healthcare. It's been a massive undertaking, and it will continue to be a lot of work in the future. But that's just one good example, in my opinion, of us recognizing where we could make improvements and going forward and making those improvements. So I'll keep you informed. I think we're right now in this sort of waiting, to see what comes out of committee, what gets voted out of the Senate. I'm hearing the same thing, that it likely will eventually get voted out of the Senate. But there's a lot of room in between what the House's current proposal is and what the Senate's proposal and what that will look like at the end of the day. So I think this will keep with us for the rest of this year. I would imagine we'll hear more and more about it as the months go by and there's, the end of the session.
And
Both of those politicians are termed out.
And what the governor decides too. She's been really quiet
Yep.
on a number of fronts. But you'll see as the summer progresses, that she'll become more vocal as it gets closer and closer.
To election time.
But she has been really quiet about
Mhm.
any changes in the community mental health system, has she not?
Yeah, no, she has not come out with a statement and the department has not issued any statements either.
She's worked. They said today, we talked about that. This is the governor. I said to him, would the governor sign either one of those bills right now? They have no idea. They said she is keeping it very close to her vest, but they said she's worried about the election.
Yeah.
So there's where they don't want to give the other side ammunition to fight her on something,
Mhm.
so.
I'll keep you up to date to the best of my ability. I'm gonna move on to the LRE. So I don't have any news for you on past liabilities. That's one of the things that's still sort of hanging out there. If you recall, in years past, several counties spent their own dollars in order to meet their budget. And we've been in talks with the department about how we might be able to reimburse those past liabilities. And to date, there's no good answer. Keith hasn't heard anything either. We're in the middle of a site review visit with the LRE. Our exit interview is tomorrow. That's been a ton of work on our staff as well. They're doing it differently this year, and we were sort of the guinea pigs. And it's been quite extensive as far as what they're asking for, what proofs they want. So I will let you know how we do on that, that audit after tomorrow's meeting. And then we're also still having discussions about the LRE bylaws and operating agreement. That's been the topic of discussion for the last couple of board meetings for the LRE. And just when I think Mary thinks she's got it all wrapped up, there's more questions. So those are still pending, but when they are finalized, they will come back to the CMHs for acceptance on those as well.
The board composition will look different.
Yep.
But it perhaps will look, to me, it looks a little bit more, there's more equitable representation. So it's not so heavy with some counties that have a bigger piece of the budget. Am I assuming that correct?
Yeah, so one of the proposals is to change the current representation, which is based on population, to every CMH having equal board membership, which is 3 members. And the hope is that one of those board members would be from the CMH board, one would be an at-large community member, and one would represent one of the populations we served, either a primary or secondary consumer. So that is a change. One of the other pretty significant changes up until now, if this is approved in the bylaws, contract agencies could be on the LRE board. They can't be on the CMH boards, but they were allowed to be on the LRE board. And one of the proposed changes is to disallow that due to conflict of interest. We currently have 3 board seats. Matt's one of those representatives. Peg Driesinga from Harbor House is one of those, and we have a vacant position. And with that change, Peg Driesinga would be turned off at her next renewal, which I think is in May. So I have mixed feelings about, not about the change in the number of representatives from each CMH, but I don't really actually see the conflict of interest at the LRE for a provider organization to sit on the board. The LRE doesn't hold contracts for providers for services. I think they're a valuable voice. I can see how, you know, if we were talking about money and budgets and dollars going to CMHs, how that would impact a provider organization that contracted with the CMH. But I guess I would argue there's conflict all over the place. You know, Matt's sitting on a representative, and if anything were to be discussed that could be harmful to Ottawa County, I'm quite sure it'd be difficult for you to remain impartial to Ottawa
That would be
County.
very hard, yeah.
Even though we
I'm gonna stick up
ask
for my county.
people. Yeah. So I don't know if that will actually get put in there. There is some disagreement about the provider organizations. I'm not hearing any opposition to the number of representatives. But I'll let you know, it's been Mary Dumas, I think, would have already had those approved, but there's been quite a bit of discussion at the last 2 or 3 LRE board meetings. So I will, I'll keep you up to
Been
date on
good
that. as well.
discussion though,
Yeah.
I think.
So I'll move on to CMH, and we can talk about the proposed motion here. We, as you know, we have been working very closely with our provider network throughout COVID to make sure that they are pretty stable. Along with COVID came the staffing crisis that is still with us. And I don't think I've been shy about telling you that it truly is a dire problem, not only in Ottawa, but really throughout the state. So we have, I meet regularly with many of our providers. We have a quarterly provider network meeting. And when we hear that one of our provider organizations is struggling due to staffing, being able to afford what really now amounts to a lot of overtime and incentives to work shifts, we try to respond to them. And one of those ways has been through the specialized residential stabilization program that we implemented about 2 or 3 years ago with millage funding. It went from 500,000. We asked for an increase to $1 million last year. And I'm actually asking that budget go up to 1.5 million this year, because we have several new providers who have come to us and asked us for some one-time stabilization payments. So I think that additional $500,000 should cover the new requests that have come in.
What would be an example of that?
Of a request?
Mhm.
You mean a specific agency or what they would
yeah.
spend it on?
Well,
So at the moment, we have been approached by Hope Network. And they've explained to us that because of primarily overtime, having to increase wages anyway, which is a good thing. I don't have a problem at all increasing wages, but then on top of that, they have, even with those increased wages, they have still struggled to find staff and keep staff. So they are having to pay the staff they have overtime. And they're having to be pretty creative with incentives like shift differentials, paying up to $100 if you'll work a shift, just because they can't get anyone else to do it. We're-
additional shift than what is
Mhm.
assigned to them?
Yep, yep. So if someone calls off
Oh,
or
yes.
there's a hole in the schedule.
You work second shift now.
Yep. That's one example. We have others that have approached us, and we've helped out our providers in the past with those particular issues. We've already had 2 homes closed due to the inability of our providers to staff their homes. We're still struggling humongously with providers finding enough staff to just work the shifts. It's creating all sorts of problems with us with placements. We really can't place anyone, even when there's a vacant bed, because they can't find the staff and they're not adequately staffed to cover all the, to take care of all the people. So this is just, again, we do have some millage savings. I think it's money well spent. We do ask for proof of their financial situation and what they're spending it on. They know that it's a one-time, that we can improve it for this year, that we might not do it next year. So they're all aware of that. So
Have you had any ratio, staff to client where you need, 1 staff, 3 clients where that did not meet?
mhm.
Yeah.
Yeah, I mean, no one is, I think they're covering, no one's unsafe, but boy, they're telling me that it's getting close.
Okay.
We have utilized our Network 180 has been pretty gracious. They set up a staffing pool with 1 or 2 of their organizations where they would kind of help out a
On-call
home,
staff,
a little bit. Bill Ward was good enough to allow us to use that, but I think that program, they're struggling themselves even to staff that. So I don't know that that's going to be a long-term option for us. They did help us out in a pinch with 2 of our homes. So we're looking for options. Until things settle down with staffing, I don't really know what a good answer is. I've told you before that we're working on some long-term solutions to try to make that direct care worker position be more of a career. We have been responsive to rate increases for our providers. We kind of led the charge on that as far as renegotiating rates so that people could pay comparable to some other entry-level jobs. The problem, as you know, is it just keeps going up and up. So, you know, we got our people up to $16, $17 an hour. Well, then McDonald's is paying $19, $20 an hour. So I don't really have the answer here unless anybody else does. I'd love to hear it. So again, this is, we're doing the best we can to try to stabilize our providers so that no more homes closed. They don't give any 24-hour notices or 30-day notices. And I'm holding my breath till something gives as far as the staffing problems. In the meantime, try and find some solutions as well. So this stabilization plan is one of those places that can help. I don't know if you want.
While it's fresh, would anybody like to make a motion to approve this stabilization plan, which would be to increase the budget from 1 million to 1.5 million?
So moved.
Supported.
Any further discussion? Seeing none, all those in favor of the motion to increase by $500,000 indicate by saying aye. Aye. Those opposed, that motion carries.
Thank you. I'll wrap up. I don't have a whole lot more, as far as positions go internally. We have been having a little bit more luck filling positions. A lot of that, I think, has to do with the fact that we went outside the normal recruiting for the county and posted on some additional sites. So we have filled almost all of our positions. The master's level clinician positions are still a problem. We're still having a difficult time filling those jobs. I did want to let you know, we had a discussion with the Sheriff's Department and Human Resources and John Shea about trying to increase the crisis intervention team that we've currently got 2 teams up and running. We'd like to have 2 additional teams. And we think that through CCBHC, one of the requirements of CCBHC is that we provide 24-hour, 7-day-a-week crisis response. So we're looking at possibly, even before the budget is due to the county in that process, standing up another team, which would be a master's clinician on our part and a deputy from the sheriff, and have that team work second shift. With the thought that we would then try to get another team up and running next year as part of the county budget.
Is that same team that there's a CMH worker and a deputy from the Holland PD? Okay.
Yeah. Right now we have 2 teams. One's from Holland PD and one's from the sheriff.
So you have a total of 3 teams?
Yep. Yep. So I'll tell you more about that as it progresses. We're currently have to do a budget adjustment with the grant, and obviously that would have to go through the county process of finance, etc. I do have a meeting set up in the near future with Ryan Kilpatrick from Housing Next and Amanda Rhines, who's from Disability Network Lakeshore. Both of those people have a lot to do with housing, affordable housing and accessible housing for people with disabilities. Along with that, staffing shortage issue is a problem with finding affordable housing. So right now, apartments are really out of reach for many of our people that we serve. So we're going to start some conversations with them about what we might be able to do to attract some housing that would be specifically for our folks. So that's all. Oh, you wanted me to talk about public comment at the
Yeah,
Board of Commissioners?
the
Yeah.
language that is somehow, I don't know if it came from the feds or the state or, but
Yeah.
it was a little confusing.
Yeah, so in a nutshell, it was public comment at the Board of Commissioners meeting on Thursday,
Correct.
and there was some concern about a question that we had asked of consumer and her mom about gender identity. And gender obviously is a demographic that we have to report through our contract with the department. Gender identity is a CARF requirement. So what we're doing right now is trying to do some investigation into what actually happened in that interview. So we'll talk to the staff that was involved. I did get the names of the individuals, so we'll just try to see what happened in that situation, and if there was maybe some more sensitivity we could bring to that question, we will definitely talk to staff about that.
But if you give blood, you know, the blood drive, they ask you, are you a male or female?
Yeah,
And
it's a issue that is
I don't
important.
know, I never looked at it before that.
But
We
that's
have-
self-description, though, right?
Pardon?
That's a self-description kind of thing.
Yeah.
So if they're gonna identify one or the other, they're not gonna say the opposite.
So really, you know, in some ways, then why ask the question? Are you human or non-human?
Well, yeah, those are good questions. By all means, there are probably as many people who would support us asking that because they
Yeah,
might have been born one gender, but they identify as another. And as everyone knows, there's a whole lot of issues surrounding that right now with schools and bathrooms, for instance.
Even just use of pronouns, how does that
Mhm.
person identify and want to be
Yep.
referred as?
Yep.
He, she, they, them.
Right.
Mhm.
And I think in that comments, there were, I heard a little bit of, that's none of our business and we shouldn't be asking questions, which I think is fair. You don't have to answer all the questions that we ask of you. We let people know that there are some sensitive questions or things that people might not want to talk about, and that's fine. They don't have to answer those particular questions. So we do let people not answer things that they don't feel comfortable answering. But I'll find out more about that
Okay.
particular situation.
Because like if I go to the doctor's office, they ask a whole bunch of questions. I mean, all right, I'll give them my license, but I'm not gonna write down my social security number.
Mhm.
And I've never had anybody come back and say, well, you didn't put down your social security number, even though I have a line item for that.
Mhm.
So that's what you're saying in essence.
Yeah, by all means, we should be letting people know if they don't feel comfortable answering the question, they don't have to answer it.
General information, comments, meetings attended. There is one thing I wanted to mention is it's time for that committee to select a chair, a vice chair, and a secretary. And I know that we've had Bob and Dave and Doug Zylstra on that committee before. And so we would kind of like to have that committee start to work on that process. So I don't know if Bob, you want to
That's fine. I can do that.
continue, or whether you're interested to continue,
I'll
or
do whatever
if
you need.
somebody else wants to be on that. Doug isn't here, so we could always give it to Doug,
yeah. I
or we
know
could
that.
I
surprise
think
Doug
Doug's on
and
the-
just have Terry.
Doug's
do
on
it.
the phone, so
Huh?
he's on the
Oh,
phone.
he's on the phone?
Yeah.
Doug.
I just asked him to unmute.
You're getting railroaded, Doug.
What we were thinking about, doing that next,
Sure, that's April is the annual organizational meeting, so
Okay.
beginning of the meeting is when we do that and elect officers for the
Okay.
year.
so
So Doug's not saying no.
Doug's not saying no?
Okay, good.
All right, there it is. That's
Yeah.
Bob and Dave and Doug.
Okay.
Anything else for meetings attended group? We stand adjourned.
What about
Thank
our
you.
final,
Oh,
final
public comment. Do we have anybody on public comment? Besides Doug?
If there's anyone who wants to make public comment, could you please raise your hand on the call?
Nope. Okay, well then we stand adjourned. There's no public comment. Good. Thanks, everybody.
We're not on camera. Okay.